Nephrologist warns, 5 pills that are harmful for your kidneys after age 60. 3 easy solutions. Aging changes the body in quiet ways, and after 60, the kidneys become more delicate than ever before. Many people continue taking common pills every day, unaware that these same medications could be slowly damaging their kidneys. The danger often hides in plain sight, in painkillers, supplements, and even routine prescriptions trusted for years. What feels safe today may silently lead to serious kidney problems tomorrow. Understanding which pills to avoid and what simple steps can protect kidney health can make the difference between strength and struggle in later years. This knowledge could protect life, energy, and independence. If this information matters, take a moment to support the channel by liking the video and subscribing for more simple, life-saving health tips. Share your thoughts or questions in the comments, because every discussion here helps others stay healthier, stronger, and more aware after 60. Common painkillers such as ibuprofen and diclofenac are widely used to ease joint pain, headaches, and everyday aches, but after the age of 60 they can place silent stress on the kidneys. These medicines belong to a group called nonsteroidal anti-inflammatory drugs, and some doctors warn that they can reduce the blood flow needed for proper kidney filtration. When blood flow decreases, the kidneys may struggle to remove waste and balance fluids in the body with repeated or long-term use. This strain can slowly weaken kidney function without obvious symptoms, making the risk especially dangerous for older adults. Research has linked frequent nonsteroidal anti-inflammatory drugs use to a higher chance of chronic kidney disease, particularly in people who already have high blood pressure or diabetes. Even short-term use at higher doses may cause sudden kidney stress, especially during illness or dehydration. Because the body processes medications more slowly with age, these drugs can stay in the system longer, increasing their harmful effects. Many healthcare professionals advise limiting nonsteroidal anti-inflammatory drugs use or choosing safer alternatives when possible, especially for regular pain management. Careful monitoring and medical guidance can help protect kidney health while still addressing pain safely. Ignoring early warning signs can allow damage to build over time, leading to fatigue, swelling, or changes in urination patterns that may appear much later. This is why some doctors recommend using the lowest effective dose for the shortest possible time and avoiding daily dependence on these medications unless necessary and supervised carefully by a healthcare professional. Certain antibiotics, especially when used repeatedly or without careful monitoring, can place significant stress on the kidneys after the age of 60. As the body ages, kidney function naturally declines, and this affects how medications are filtered and removed. Some doctors warn that certain antibiotics, particularly those used to treat serious infections, may accumulate in the body when the kidneys are not working at full strength. This buildup can increase the risk of toxicity and kidney injury over time. Research has shown that older adults are more vulnerable to drug-related kidney damage because their bodies process medications more slowly. When antibiotics remain in the system longer than expected, they may interfere with the delicate filtering system inside the kidneys. In some cases, this can lead to inflammation or a sudden drop in kidney function, especially if the person is already dealing with dehydration or other health conditions. Improper dosing is another concern. Without dose adjustments based on kidney function, even commonly prescribed antibiotics can become harmful. Some doctors emphasize the importance of kidney function tests before and during treatment to ensure safe use. Warning signs such as reduced urine output, swelling, or unusual fatigue may appear if the kidneys are under stress. Careful use, proper medical supervision, and avoiding unnecessary antibiotic use are often recommended to reduce these risks. Taking antibiotics only when truly needed and exactly as prescribed can help protect kidney health and prevent long-term complications in older adults. Proton pump inhibitors, commonly used to treat acid reflux and heartburn, are often considered safe for long-term relief, but extended use after the age of 60 may carry hidden risks for kidney health. These medications work by reducing stomach acid, yet some doctors warn that long-term suppression of acid can trigger unexpected effects in other parts of the body, including the kidneys. Research has linked prolonged use of these drugs to a higher risk of kidney inflammation, also known as acute interstitial nephritis. This form of inflammation can develop quietly, sometimes without clear symptoms in the early stages. Over time, Repeated or untreated inflammation may lead to chronic kidney disease. Studies have found that older adults who take these medications regularly for months or years may face a greater chance of gradual kidney function decline compared to those who do not use them long-term. Another concern is that these medications are often continued without regular review, even when symptoms improve. Aging kidneys are more sensitive to long-term medication exposure, making it important to reassess the need for continued use. Some doctors advise using the lowest effective dose for the shortest possible time and regularly evaluating whether the medication is still necessary. Warning signs, such as fatigue, swelling, or changes in urination may appear later, once kidney function has already been affected. Careful monitoring and medical guidance can help reduce these risks while still managing acid reflux safely in older adults over time. High-dose vitamin supplements, especially those containing vitamin D and certain minerals like calcium, can place unnecessary strain on the kidneys after the age of 60. While vitamins are often seen as safe and beneficial, taking them in excess may lead to imbalances that the kidneys must work harder to correct. Some doctors warn that fat-soluble vitamins, such as vitamin D, can build up in the body over time because they are not easily excreted, increasing the risk of toxicity. Research suggests that too much vitamin D can raise calcium levels in the blood, a condition known as hypercalcemia, which may lead to kidney stone formation or even kidney damage if left unchecked. The kidneys are responsible for filtering and maintaining proper mineral balance, and excess intake can overload this delicate system, especially in older adults whose kidney function may already be reduced. Many people assume that higher doses provide stronger protection, but studies indicate that more is not always better, particularly when supplements are taken without medical supervision. In some cases, long-term overuse has been linked to a gradual decline in kidney function due to the constant extra workload placed on these organs. Healthcare professionals often recommend sticking to advised daily amounts and avoiding unnecessary high-dose supplementation unless prescribed. Regular monitoring of vitamin levels and kidney function can help prevent complications. Paying close attention to dosage and medical guidance allows the body to benefit from essential nutrients without placing avoidable stress on the kidneys over time. Certain blood pressure medications are essential for protecting heart health, but after the age of 60, they must be used with careful monitoring to avoid unintended effects on the kidneys. These medications, including some that relax blood vessels or reduce fluid buildup, can influence how the kidneys filter blood. Some doctors warn that, if the balance is not right, these drugs may reduce filtration pressure too much, leading to a temporary or sometimes lasting decline in kidney function. Research shows that medications such as ACE inhibitors and ARBs can be both protective and risky, depending on how they are used. In many cases, they help slow kidney damage, especially in people with high blood pressure or diabetes. However, if doses are too high or if the body becomes dehydrated, they may cause a rise in creatinine levels, indicating stress on the kidneys. This is why regular blood tests are often recommended to track kidney performance during treatment. Older adults are more sensitive to changes in blood pressure and fluid balance, making close supervision especially important. Even small shifts can affect how well the kidneys are able to filter waste and maintain stability in the body. Some doctors emphasize adjusting doses gradually and watching for warning signs such as dizziness, swelling, or reduced with proper guidance and routine monitoring. These medications can continue to support both heart and kidney health. The key lies in balance, ensuring that treatment remains effective without placing unnecessary strain on the kidneys over time. Staying properly hydrated plays a critical role in supporting kidney function, especially after the age of 60, when the body's natural fluid balance becomes more delicate. The kidneys rely on adequate water intake to filter waste products from the blood and remove them through urine. When fluid levels drop, this process becomes less efficient, and toxins may begin to build up in the body. Some doctors warn that even mild dehydration can reduce blood flow to the kidneys, placing them under unnecessary strain. Research shows that older adults are at a higher risk of dehydration because the sense of thirst often becomes weaker with age. This means the body may already be lacking fluids before any clear signs appear. Without enough hydration, the kidneys must work harder to concentrate urine, which over time can increase the risk of kidney damage or the formation of kidney stones. In some cases, dehydration can also lead to sudden kidney stress, particularly during illness, hot weather, or when taking certain medications. Studies suggest that maintaining consistent fluid intake helps preserve kidney efficiency and supports overall balance in the body. Healthcare professionals often encourage steady water consumption throughout the day rather than waiting until thirst becomes noticeable. Paying attention to urine color and frequency can offer simple clues about hydration levels. Maintaining this habit provides ongoing support to the kidneys, helping them function more smoothly and reducing the risk of long-term complications. Regular kidney function testing becomes increasingly important after the age of 60 because early kidney stress often develops without clear or immediate symptoms. Simple blood tests, such as measuring creatinine levels and urine tests that check for protein or other abnormalities, can provide valuable insight into how well the kidneys are working. Some doctors warn that by the time noticeable symptoms appear, such as swelling or fatigue, significant damage may already have occurred. Research shows that routine monitoring can help detect small changes in kidney performance long before they become serious. This early detection allows healthcare providers to make timely adjustments in medications that may be affecting the kidneys. It also helps identify underlying conditions, such as high blood pressure or diabetes, that may silently impact kidney health over time. Older adults are more vulnerable to gradual declines in kidney function, making regular testing a practical and protective step. Even stable individuals may experience changes that only laboratory tests can reveal. Studies suggest that consistent monitoring improves outcomes by allowing earlier intervention and reducing the risk of progression to chronic kidney disease. Healthcare professionals often recommend scheduling these tests at regular intervals, especially for those taking long-term medications. Tracking results over time provides a clearer picture of kidney health and helps guide safe treatment decisions. This simple habit supports early awareness, offering a chance to protect kidney function before problems become difficult to manage or reverse. Choosing kidney-friendly alternatives becomes an important strategy after the age of 60, especially when managing long-term pain or chronic health conditions. Safer options, such as adjusted prescriptions or non-drug approaches to pain relief, can help reduce unnecessary stress on the kidneys while still maintaining comfort and quality of life. Some doctors warn that repeated use of certain medications can accumulate strain over time, so finding balanced alternatives is often recommended. Research suggests that non-pharmacological methods, including gentle physical therapy techniques, heat or cold application, and guided movement therapies, may help manage discomfort without adding extra load on kidney function. In some cases, healthcare providers may also adjust medication types or dosages to better suit aging kidney performance, ensuring that treatment remains both effective and safe. Older adults often benefit from individualized care plans because kidney function naturally changes with age, affecting how the body processes different substances. Studies show that small adjustments in treatment approaches can significantly reduce the risk of kidney stress while still controlling symptoms like pain or inflammation. Healthcare professionals frequently emphasize collaboration between patients and providers when selecting alternatives. This ensures that any changes in treatment are both medically appropriate and tailored to personal health needs. Over time, these careful adjustments can help preserve kidney function while maintaining daily comfort. By making informed choices under medical guidance, it becomes possible to support overall health without placing unnecessary burden on the kidneys. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.